Health Organization declared COVID-19 a global pandemic in March last year. Most people relied on updates from the media. A group of academics have now been looking at how print media in South Africa handled issues relating to the coronavirus, and they found that the reporting in the early months was alarmist, sensationalist, and negative in tone. One of the people who worked on the study is Associate Professor of Media Studies at the University of Cape Town, Wallace Chuma, who's joining us from Cape Town, I believe, tonight. Sir, very good evening to you. Thank you for being on News at Prime. So, alarmist, sensational, and negative in tone. How did you reach that conclusion?
Thanks a lot for the invitation, and greetings to you. So, between March and May last year, myself and my colleagues put together a research project on sort of focusing on the ways in which the media reported on COVID-19, and this was the period of the first lockdown. And we took a sample of close to 800 articles from 11 South African newspapers, both regional and national papers. We focused on front pages, and we were interested primarily at basically the coverage of this pandemic in the initial stages. We drew a code book with a whole range of sort of different variables and indicators. We wanted to get like a sense of just how our sort of local media in South Africa covered this phenomenon, this pandemic. And so the publication that we had, in fact, we had two publications. The first was a longer journal article in the Journal of African Media Studies, which was published a month or two ago. And the other is the conversation paper that was published this week, which I think sort of ignited a lot of interest publicly. But so we found that from the samples that we take of front page stories, the predominant tendency was to sensationalize coverage. It was to be alarmist. The tone was negative. The sources that were sort of enjoyed the pride of place, the coverage, were government officials. So it was basically a story that was alarmist, negative, sensational, and a government mail story.
And was it deliberate or really more driven by the fact that the people who were doing the reporting on the pandemic in the early days were themselves perhaps not as clued up as they should have been?
It could be that, but also remember, this thing was not planned. It was not, I mean, the media, not just in South Africa, but elsewhere, were not prepared for this pandemic. People are rarely prepared for pandemics anyway. But so I must also tell you that we went through research on the coverage of the pandemic, this pandemic and previous pandemics by the media in other parts of the world, and we found that this was a tendency, especially in the first days of the pandemic, as people sort of grappled with the meaning and the implications of this new phenomenon. And eventually, I would imagine they would get used to it. So I agree, it was probably because no one was prepared for this. And the messaging predominantly was from government. And it was like, we are in this war. In fact, the metaphor of war kept creeping up, sort of coming up in the headlines that we saw. So it was, this is war, which we have to win. There was sort of emphasis on the scrambling to get vaccines, scrambling to get this. So that was sort of the language that we found. So yes, it could be. In fact, most likely it was because no one was prepared for this.
And what then was the impact on the readership?
It's difficult. We didn't look at that at all because that would have required us to go and interview people. Our study was a predominant content analysis. But you know, the interest really was to, of course, we know that how the media cover issues such as these has profound implications for how citizens respond to the pandemic. You know, mitigation, you know, medication, you know, all sorts of other things that have, you know, citizens have to do in order to respond to pandemics. But we could not, and remember we did this study under conditions of lockdown last year. We could not go out to get a sense of how citizens received the message that the media sent out.
And you teach media studies at the University of Cape Town. I'm wondering if, from your reading, we need to go back to a time, because this has been a point of criticism from the media, for the media in South Africa, especially for a long time now, that we're not specializing enough. Perhaps we need to go back to investing more in specialized health reporting, so that the people who do the reporting are like the Mia Malans, who are able to go through the data without the rush of feeding the everyday news beast.
I agree with you absolutely. So one of the things that have happened over the past, say, decade, in fact, it dates back to the 2008 financial crisis, is the general sort of decline in funding and financing of the media, not just in South Africa, but globally. Think about what happened during the lockdown. I think we lost several publications here locally in South Africa. So, and this came against the background where the media were, sort of newsrooms were being sort of slashed to the bone. This publishes an annual report on the state of the newsroom in South Africa. I'm sure you know about that. I mean, the funding and financing of the media has been going down drastically, and that has affected the extent to which you would have journalists specializing in, say, proper health communication and health reporting, and going onto the ground and telling stories. So now we've got a phenomenon of sort of just calling, getting a story, or newsrooms hiring interns, or freelancers, and you know that story better than I do. But yes, you're right. There is need for investment in financing of media organizations.
On that point, then, have we got better at telling the story of the pandemic as South African media?
I would think so. We haven't done a follow-up yet. Remember, our study just focused on the first 3 months. But just by looking at what we are happy, what I'm reading now personally, and sort of my interactions with the media, I think I get a sense that as journalists have become more aware of what's happening, but also as lockdowns have been, sort of revised downwards, and people are moving more and more out, you've got journalists having more time to interact with citizens and get citizens' stories. But I would need to do a specific scientific study to get a sense of how the shifts have happened from the early stages of the lockdown to now. For example, now the debate in the media is more about vaccination, anti-vaccination, the fake news, etc., etc. But one would need to do like a proper scientific study to get a sense of how the shifts have taken place.
So good to speak to you, sir. That is Associate Professor Wallace Chuma, based at the University of Cape Town, where he's teaching media studies. Good to speak to you tonight, sir. Thank you.
Thanks a lot.